I think this is an important topic to be talking about all of the time. There are several things right now that make it an even more urgent topic, I think. One, of
Mhm.
course, is the pandemic that we've all been living with for a year and a half, and all of the other things, disruptions that have happened as a result of that. The other is the holiday season, which is often pretty stressful for people. I think it's even more stressful in some ways right now. And then, of course, this past week, we saw a mass shooting in a school here in Southeast Michigan. And
Yes.
of course, that is one of the most stressful things I can remember experiencing. My kids don't go to that school. I don't live in that community, but it's so close. And you can see yourself and your family in the eyes and the responses of the people involved. So, talk just a little about what that's like, what you are seeing in terms of the mental health needs that people have right now.
Well, the mental health needs for the general population is actually through the roof right now. We all remember in 2020 the images and the media reports and the sound bites of the doctors and the nurses working in the physical healthcare hospital systems about how overwhelmed they were in the emergency rooms and all of that. Now in 2021, while that's somewhat, abated a bit at times, it's the mental health system that we're now seeing our biggest surge of people seeking mental health care than we ever have at any point in time. So a lot of people don't typically equate mental health care with the larger physical health care space, but your mind is just important as your body. So literally we are slammed every single day with almost more people than we can take seeking mental health care. And they're presenting with things such as substance abuse issues, depression disorders, usually stemming from loneliness and isolation, and people, who need grief counseling as well. Because as you know, during 2020, a lot of people weren't able to grieve the loss of their loved ones in the traditional way
Mhm.
that we've been accustomed to because of social distancing and lockdowns and things like that. Now we're seeing these symptoms of mental illness manifest themselves, and literally we're almost at our breaking point for how many people we can continue to serve through the door. And it's not just us; it's across the mental health care system.
Yeah. So I want to talk a little about what I would refer to, and I don't know if this is the technical term, but as community trauma. The
Mhm.
sense that the things we experience aren't just about us as individuals, but about the things that we experience collectively. And as African Americans, of course, that looks really different than it does for other populations. I'm not going to get into whether it's worse or better.
Mhm.
It's just different. Talk about the things that we've seen the last year that, as a community, affect us in particular ways.
Well, I'll start by saying that we all are familiar with the term post-traumatic stress disorder, PTSD. We've typically thought of PTSD as something that you see returning soldiers coming home from the battlefield experiencing. But one of the technical definitions of PTSD is the inability to recover from an event, a horrifying event, either witnessed or experienced. When you look at it in that context of the definition, that can fit anyone of any particular community. And when you talk about communities of color, minority communities, when you have children seeing their mothers, fathers, brothers, sisters, aunts, uncles lost to senseless violence, whether that be domestic abuse or whether that be gun violence or anything like that, those traumas remain with those individuals. And the longer they go untreated, the longer that they stay undiagnosed, they manifest themselves into alternative behaviors or violent behaviors as they get later, as they age and get later on in life. In particular, in communities of color, we do see incidences of those happen more often than other communities. So they're definitely, while mental health doesn't have a demographic, an age, or a race component, because it can affect everyone. There are certainly some communities that are more at risk for mental health conditions than others, and that is absolutely true.
And at the same time, I know of the cultural reluctance in the African American community, in some cases, in many cases, to acknowledge the importance of mental health, to acknowledge that you may be having a problem with mental health, and then to seek the kind of support and help that you need, that makes it not just a problem, but a problem that kind of folds back on itself and creates an even larger problem.
You're completely right, Mr. Henderson. Stigma, which is what we call it, is the biggest barrier to people receiving mental health treatment that there is. It's the notion that people, particularly your family members and friends, are going to look down on you or going to think less of you because you're currently experiencing a mental health issue. No one is ashamed to say that they have diabetes, that they've had a heart attack, that they have any type of other physical healthcare disorder. But for some reason, particularly in communities of color, when you talk about mental health issues, it comes with the stigma that someone is going to label you crazy. One of the things that we fight against is the notion that at any given point in time, it's okay to not be okay. Your mind needs just as much attention as your body. And just about every mental health issue out there is treatable with treatment, just like you can treat certain illnesses and infections with antibiotics. You can treat mental health issues as well with therapy and certain medications as well. So it's not some type of lifelong sentence that you just have to struggle with alone and without support. The help is out there, the technology is out there, and we can help people along their road to recovery. And most of the people that we see through therapy and our interventions go on to live normal, productive, healthy lives with healthy relationships and healthy employment opportunities. And most people would never know.
And I do want to give you a chance to talk some about this school shooting that we saw here in Southeast Michigan. Oxford is a community that I don't know that well. I don't feel a lot of connection to that community. It's really different from where I live in Detroit. And yet I find myself really jarred by what happened there and scared about the prospects for the same kind of thing to happen closer to home or someplace where my children are. How do we explain these things to our kids? How do we explain these things to our family in a way that accounts for the mental health impact of this kind of thing?
Well, when you talk about Oxford is actually one of the areas that we do service out here in one of our locations. It is completely tragic and unfortunate that issue had to happen. We have to start realizing that our kids are dealing with things that older people as myself never had to deal with when I was coming up, when I was in high school. The advent of social media, this whole more connected society where anyone can have a platform about anything, from bullying to body shaming to all the things that kids deal with these days. One of the things that we've been primarily focusing on in a lot of our school-based services is suicide prevention, for example. We have to start to pay more attention to what our kids say, to what our kids think, how they're feeling, and to actually sit down and talk to them about things that are going on in their lives. Oftentimes you hear parents say, there aren't enough hours in the day and we're too busy. And some of that is true, but you have to start to find time to get more involved in your kids' lives and pay attention to the things that they say. Things about, I feel like killing myself today. That's not a throwaway line. That's not something you ignore, something that you write off as someone just simply having a bad day. Those types of things need to be talked about, investigated, and see what the actual root cause is behind that. Now, I'll tell you another thing about school-based services. We have a very robust program, and we're in over 20 schools right now with our mental health care services. By and large, the students are not the issue. We have students who come to see our social workers where they're lined up outside the door in the morning waiting for the social worker to come in because they need that outlet of someone to talk to than someone that can help them. Oftentimes, the biggest barrier to children receiving treatment is the parents.
The parents, wow.
You normally wouldn't think that, but it's the parents. There are only so many services that we can deliver to a child in Michigan because of state laws without consent. Prior to that, you need to have parental consent. Now, I'm not saying that every parent is like that. Most parents are like, hey, little Michael needs help. Sure, where do I sign? Sign them up, keep the services going. But there are some parents who refuse to admit that little Michael might actually have an issue that he needs some support with. Wow. And it takes a Herculean effort with us, the schools, and everyone else to sometimes try and get that parent to come around and say, hey, we're not looking to cast you as bad parents. We're not looking to take your child out of the home. We're just looking to provide the help that this youth needs at this moment. And some parents agree and some parents unfortunately don't.
Okay, Michael, it was really great to have you here to talk with us about this. Thanks so much for joining us on American Black Journal.
No, thank you very much for paying attention to this important issue.